Welcome, everyone. Thank you for joining us for today's Town Hall. I'm Marlena Holden, Chief of Staff for Student Health and Wellbeing, and I have the privilege of working to support students in our campus community. The 4 people joining us in conversation today have spent the past 2 years working on COVID-19 policies, have answered hundreds of questions, supported academic staff, and guided us in keeping campus safe and healthy. In the next hour, we're going to answer questions submitted at go.wisc.edu/January 21st. More than 150 questions have been submitted, and you can still send in questions during the next hour. Let's go ahead and introduce our 4 panelists. Please welcome Dr. Carol Griggs, Associate Executive Director and Director of Operations at University Health Services. Dr. Griggs has been instrumental in setting up the testing and vaccine operations for campus. Dr. Griggs will speak about what campus can expect for testing this spring. We also have Dr. Nasia Safdar, Associate Dean of Clinical Trials, a professor of medicine at the UW School of Medicine and Public Health, and a medical provider. Dr. Safdar is on the front lines of managing the pandemic in a hospital setting and supports campus by reviewing policies and plans. Please also welcome Dr. Ajay Sethi, Associate Professor of Population Health Sciences at the UW School of Medicine and Public Health, Director of the Master of Public Health Program, and an infectious disease epidemiologist. Dr. Sethi has served on numerous campus-wide policy groups and generously shares his epidemiology expertise. And we also have Dr. John Zumbrunnan, Vice Provost for Teaching and Learning and a Professor of Political Science. Dr. Zumbrunnan has worked closely with academic staff on supporting the teaching and learning parts of campus, supporting the thousands of instructional staff, along with the tens of thousands of students on campus. Thanks again to our panelists. I'm looking forward to our conversation. Before we move forward with our discussion, I want to first acknowledge that the land that UW-Madison inhabits is the ancestral home of the Ho-Chunk Nation, one of the 12 First Nations of Wisconsin. We invite you to learn about the indigenous communities that have called this land home since time immemorial. By acknowledging our past, we can move toward a shared future. These truths are part of the Wisconsin experience, and we honor them today. We hope the conversation today will help answer questions that have been on your mind. Again, more than 150 questions were submitted through the link below, go.wisc.edu/January 21st, and we can continue to accept questions throughout today's conversation. I'd also like to thank our partners at McBurney Disability for providing captioning today. You can find the links listed in the event description below this video for those services. I'd also like to remind people that UHS is offering no-cost COVID-19 vaccines and boosters at the main UHS clinic located at 333 East Campus Mall. This is available at no cost for all UW-Madison staff and students. Since we have a lot of questions to cover, let's dive in and start with where we are now. This has been a challenging time for all of us, and for some, starting another semester with many unanswered questions can feel confusing. I want us to start with what's going well on campus and in our community, and I'm going to turn to Dr. Safdar and Dr. Sethi. So Dr. Safdar, many people are closely following case counts. The news shares national and state numbers daily. Can you please speak to why there's so much talk about case counts and what numbers you both look to get a sense of where we are?
Sure, happy to answer that question, and thank you for the invitation to serve on this panel. I think, case counts up to a certain point serve a valuable purpose because they can give people an idea, and especially with Omicron, it gave us an idea of how rapidly things were spreading, how contagious this was, so that people could prepare and expect to see what we are now seeing. Once it becomes as widely prevalent as it is in the community, we know that these case counts are an underestimation of the real picture because, of course, a lot of people are doing testing at home and those often don't get counted in the case counts. So it serves, I think, some purpose, which is to tell us that it's prevalent, it's around us, it's everywhere at this point. But beyond that, I think the more important metrics that we look for are the need for healthcare, whether it's emergency room visits, hospitalizations, other complications, and long-term consequences of this infection.
Thank you. Dr. Sethi, what numbers are you looking to?
Yeah, I'll echo what Nathu said. First, I'm happy to be here. When I look at the data, as an epidemiologist, I try to pay attention to what populations are being captured with a given, epidemic curve or trend line, and often it's a large population. So, the current spike in Omicron definitely is affecting everybody, but it doesn't necessarily have to be sort of an individual person's reality. And I try to dissect the data, look at trends, by age. Again, I see that everybody's affected. And I just remind myself that as daunting as it is, this is just an opportunity to remind myself and others to go back to basics of how to prevent transmission, and eventually these case numbers will hopefully come down.
Thank you. If you're just joining us, welcome. Our conversation today is with 4 campus experts helping us talk through about what we can expect for the spring semester. Again, you can find links for captioning listed in the event description below this video, and you can also continue to submit questions at go.wisc.edu/January 21st. Again, I'd like to thank our partners at McBurney Disability for captioning today. Next, I'm going to turn to Dr. Zumbranin. There's a lot of questions that were submitted, and the more than 150 that were submitted, about what campus is doing to support academic and instructional staff. Can you please share it with us a little bit more?
Yes, I'm happy to, and again, happy to be here today, and thanks to everyone who's joining, and thanks to everything that you've done over the last 2 years and you continue to do to support the mission of the university and help us continue to move forward. I think of a variety of things that we can think of the university doing to support our academic staff, our faculty, our university staff, our students. On one level, we have in place a variety of risk mitigation strategies and approaches, from masking to testing to encouraging everyone to be vaccinated and boosted. More specifically for those colleagues who may have particular accommodation needs, we do have, through work with divisional disability representatives, opportunities to explore accommodations in the workplace, including for instructors in the classroom. I think in particular about instructors, given my position, and think about instructors are going to face this coming semester situations where students are missing class. There may be some circumstances where multiple students in a particular class are missing. There may be circumstances where the instructor themselves test positive or become ill and are not able to be in class. In those instances, the best source of support is going to be supervisor, department leadership, school, college leadership. We really encourage you to be in early and frequent conversation with those folks. More generally, for support on teaching, instructors who are continuing to adapt their teaching to the realities of the situation we find ourselves in, can find support for their instruction in their school and college, or at our Center for Teaching, Learning, and Mentoring, ctlm.wisc.edu. And then the last thing I want to say is, just broadly speaking, beyond the particular circumstances that any of us may find ourselves in, this continues to be a fluid and very challenging time. I think, in the broadest sense, we can all be there to support one another, but certainly I encourage everyone to turn to the Office of Employee Assistance for support and for guidance in finding other means of support.
Thank you. And you're teaching this semester. I know that Dr. Sethi is teaching this semester. I'm going to go back to you, Dr. Zumbranin. Can you talk a little bit then about what this looks like for you teaching, and then I'll go to Dr. Sethi and what that looks like for him teaching in person?
It's interesting. I taught in the spring of 2021 in person as well. And again, I'm teaching starting next week in in-person class. And, the situation with COVID is fluid. And so Last spring, there wasn't an Omicron variant around. On the other hand, we also didn't have vaccines yet. This spring, I'm walking into a classroom with, knowing that I myself am vaccinated and boosted, and knowing that a large percentage, up in above 95% of students on campus are vaccinated, and we're encouraging everyone to get boosted. So I think about going in the classroom and trusting those mitigation strategies. A real highlight of last fall, and something I'm grateful for and proud of, is the way our students responded to what we asked them to do in regards to risk mitigation. So, students did what we asked them to do to help us reduce the risk of COVID on campus. And that's comforting to me, and I find some real assurance in that fact. So, going in the classroom, if you haven't been in the classroom teaching in person before, walking in the classroom wearing a mask with everybody else wearing a mask is an adjustment. My own experience last spring is that I made that adjustment, and it pretty soon felt like teaching a class has always felt in all the ways that matter to me. So, for me, I cannot wait to be back in the classroom, to meet a new group of students, and to dig into the content of my course.
Dr. Sethi, what about you? You taught last semester and you're going to teach again this semester.
Yeah, and they were definitely different classroom dynamics. Last fall, I taught a class in a lecture hall. There are 50 students. This semester, it's going to be a smaller class of about 16 students. Ironically, the class is infectious disease epidemiology this spring. A lot of pressure to make sure that we do everything safely, and I'm confident that we can. I certainly will, wear a well-fitted mask, teach like normal. And I'll say from my experience last fall, giving that first lecture in person after over a year of doing that, it felt normal. It felt great. I finished on time. When I was teaching remotely, things always seemed to take much longer, and never could accomplish as much within the same class period. And things felt normal in the fall. I trust they will in the spring. I think we'll just take it one step at a time, stay flexible, be forgiving of each other if we need to miss class.
Great, thank you. And we're going to come back to talking about teaching and learning throughout our conversation. I want to go to another frequently asked question, and this one will be for Dr. Griggs. This is about testing and vaccine plans for the spring semester. Can you please share with folks the outline of what we can expect this semester?
Yeah, absolutely. I think it's probably easier to start with vaccines, and then we'll go to testing. So from a vaccine standpoint, we are still offering our vaccine clinics on campus. This semester, they're going to be at University Health Services. And one of the strategies that we have put in place just to kind of help folks get boosted, if they do want to in fact get boosted, is increase our capacity for the next couple of weeks. So we've actually quadrupled how many appointments we can have available for the next 2 weeks, actually starting on Monday all the way through February the 4th. And so if you haven't been boosted and you want to be boosted, or even if you haven't gotten your first dose yet and you want to do that, I would encourage you to go ahead and log in and schedule that appointment. One thing to note about this semester is that we will only have Pfizer available. Moderna vaccine is still available in the community if that's something that you're interested in. And there are still places that offer Johnson & Johnson, but there are fewer places that offer that. With regards to testing this semester, we actually have somewhat of a two-prong approach. We will still offer our PCR testing, actually at the exact same capacity that we offered it last semester. We will have a consolidated test site this semester, though, which is a difference from last semester. And part of that really grew out of the need to consolidate, just because we don't have the same workforce that we previously had. And I'm sure any of you that work in healthcare certainly know what that looks like and what that means. A lot of folks are leaving the jobs at this point in time, and we haven't been able to acquire the staff that we need. In addition to that, there are also some efficiencies with us running one test site. One of the goals in consolidating the site was really to ensure that we still had the same capacity and that we were running a safe site, but at the same time having the ability to do that with fewer staff members. So we will have PCR testing available. Tests are available Monday through Friday, Monday through Thursday from 8:30 a.m. to about 4:30 in the afternoon. On Fridays, our hours are going to be 8:30 to 12:30. And part of that is because we have an amazing lab on campus that's actually supporting all of our testing needs. So major shout out to WVDL, who are managing all of our tests on campus. But in an effort to work with them on how we result our samples, we do have a limited schedule on Friday. And so those appointments are ending the semester at 12:30. The same applied to last semester as well. The other element that we're adding in this year, though, is that we will have antigen testing available for pickup. Antigen testing will be available. They're available right now, actually, for students. And so it's really the students that are already on campus, those that were moving into the dorms. They can pick up their antigen test at either one of the memorials. Students that live in the rest halls actually had their tests placed in their rooms. Starting on next Tuesday, employees will also be able to pick up those antigen tests. And so right now it's only students. Students can also pick them up through the weekend. Those tests are available from 11 a.m. to 7 p.m. Right now. But starting next Tuesday, the hours will be 11 a.m. to 6 p.m. And again, employees can pick those up as well. To do that, all you need to do is show your WIS card. And that's going to be how we distribute the antigen test through February the 4th. After February the 4th, the location might change, but that information isn't available yet. Once we do have that information, we will ensure that it's on the COVID-19 response website, and I'm sure that we'll have additional communications that'll come out about that.
Thanks for that update. And covidresponse.wisc.edu remains the best place to get that information. So there's the URL listed below. Everything that Carol just talked about regarding testing and vaccines, you can find information there. I want to go and talk about masks for a little bit. That's something that Dr. Zamranin and Dr. Sethi talked about in terms of teaching and wearing a well-fitting mask. But there has been a lot of conversation about what types of masks people should be using. Dr. Softar, can you speak to that first about what types of masks we should be using?
Sure. So the most important thing to prevent transmission is that the mask be, it follows certain principles. So one important principle is that it should be close-fitting, snug across covers the nose, the mouth, over the chin, and lies flat against the cheeks. That can be done through a variety of methods. You can have a surgical mask where you can apply mask fitting techniques to make it better fitting if it needs to be. KN95s and N95s also serve the same purpose. The other principles of masks is that they should be comfortable so that you should be able to breathe through them for an extended period of time, whether it's at work or elsewhere. And so for people in healthcare, the same principles also apply. N95s can serve that purpose, but not everyone finds them comfortable to wear for extended periods of time. And so it doesn't have to be an N95 in that case. They should be multi-layered, and then they should be disposed of regularly and new ones picked up and used. So as long as those principles are applied to, there's a wide array of masks that one can use that will all serve the same purpose.
Thank you. And what is campus going to be doing in terms of distributing masks? Will people have access to more high quality masks? I think Dr. Griggs, you can take this one.
Yeah, sure, happy to. So yes, we will have masks available on campus for pickup. Those are really available for students, though, for pickup. If employees need masks, they actually should check with their departments. Departments are actually in charge of acquiring the masks that are needed for their employees. And so if an employee does need a mask, they go to their department. Those can be ordered on the procurement website. And we do have KN95s and N95 masks available.
Great, thank you. A couple questions coming in about classrooms. So hopefully, Dr. Zambranin, you can help us with this one. What should instructors do if students must miss class because they've tested positive or have symptoms? And what if the instructor tests positive or becomes ill?
Yeah, so I will take the instructor side first. So, if an instructor tests positive, becomes ill, I think the first thing to emphasize is to do what you need to do to take care of your own health, right? So you should definitely prioritize taking care of yourself. I think the other step is to be in again early and frequent communication with your supervisor or with department leadership to talk about what the best path forward is. Our goal is as much as possible to maintain the modality of courses as it appears in the schedule of classes. So if a course is in person, we want to try to maintain that in-person educational experience. Sometimes that can mean colleague coverage, but we recognize too that there may be times when the best pathway is to briefly put a course on a temporary basis that's in person into an online delivery. And again, to do that, it's something that the instructor should be talking with their department leadership and with their school college about. For students, I like to think here in terms of individual students being unable to be in class versus multiple students in a class. So for individual students, the key thing I think is to trust our students. If they report to you that they've tested positive or that they're ill, we need to take them at their word and trust them on that, and look for ways to be flexible and supportive in the same way we would if a student had another reason for missing class. If a student breaks their leg and misses class, we traditionally would find ways to be supportive and flexible for them. And, I really want to encourage instructors to think proactively about this. I think all of us who are teaching are likely to have circumstances where individual students have to miss. So thinking about what our attendance policies look like, thinking about how we can provide access to course materials and activities to students who are going to miss class, thinking about our assessments and assignments and exams and how it's possible to create some flexibility for individual students there. There's another possible case to consider, which is where multiple students in a given class have tested positive, are in quarantine or isolation, are ill, are unable to come to class. I'm happy to say that last fall, that was a relatively rare occurrence. We're now dealing with Omicron. It may be more frequent this semester. We really don't know. Here again, I really want to emphasize the importance of being in conversation with supervisor, department leadership, school and college leadership to try to evaluate the best way forward. I can tell you that in some instances last fall, when this happened, I would be in Teams meetings with those leaders and the instructor and talking through what's going on in the class, what's the nature of the course activities, how many students are we talking about, what's the best pathway forward. And the thing to emphasize there is that there's not really a one size fits all model. We've got, in any given semester, we have somewhere around 6,000 group instruction sections. If you add together lectures and seminars and labs and discussion sections, we'll have somewhere between 4,000 and 5,000 individual colleagues teaching those course sections. And that just means inevitably there's no one best way to deal with these circumstances. And so that's where we pull together and we put our heads together and figure out the best path forward.
Thank you. One of the questions that emerges is that we have an exceptional vaccination rate on campus. There are people here who have received, all the necessary doses of a vaccine and have been boosted and still might get sick. So one of the questions is, since vaccinated people are getting COVID-19, do the vaccines still work? Dr. Sethi, can you speak to that, please?
Yeah, the vaccines continue to work against protecting against having severe illness or hospitalization, especially when you're boosted. And that's where you really have an amplified level of protection. And so anybody who's not boosted yet really ought to, just because you really derive such a great benefit from that. So we're still, able to protect against the severe outcomes of COVID. With breakthrough infections are more common with the Omicron variant. And that's something that's unfortunate, but it's our reality. As new variants come out, they have a tendency to cause more breakthrough.
Thank you. We're still accepting live questions. So we had more than 150 submitted before today's talk and can still accept questions at go.wisc.edu/January1. One question that did come in about 5 minutes ago, and Dr. Softer, I'm going to have you answer this one, please. What do we know about long COVID in vaccinated people, and how can we take care not to have lingering effects of the virus?
Yes, so long COVID is a syndrome, and our understanding of that is still evolving. But there is emerging literature that suggests that vaccination does protect people against the effects of long COVID, which is yet another, factor in favor of getting vaccinated and boosted. I think the main things to do if you do suffer a breakthrough infection with Omicron, for instance, is to do all the things that you would typically do to promote your health. Rest, good nutrition, making sure that you're not getting overly fatigued, and those kinds of things while you're recovering from it are going to be important. There isn't any specific intervention that you can do at that point to prevent Long COVID, it's really the more upstream intervention of getting vaccinated and boosted that's going to help us all.
Thank you. Another commonly asked question was about would campus go virtual? Would we, depending upon any numbers, make those changes? Dr. Zembrunin, could you speak to that, please?
Yeah, so a couple reflections on that. I think first is we are a residential campus, and our primary mode of instruction is in-person instruction. We do, of course, have in particular cases, specific courses and programs that for pedagogical or access reasons offer some really high quality, amazing online courses. So in general, we've made the pivot back to distribution of course modalities that looks a lot like it did in fall of 2019. And our plan is to move forward with that schedule of courses as it exists. And we certainly don't have any plans to make a pivot to virtual. And I would just say in that context, thinking again about the risk mitigation strategies and approaches that we have present on campus, and knowing that there are flexibilities out there for instructors and students to deal with specific cases as they arise. So, that is all to say that there are certainly no plans, and I don't foresee us making a pivot to virtual. Of course, campus leadership is closely monitoring the situation and in close conversation with public health experts on campus and off. But our plan and what we're doing starting next week is moving ahead with spring semester as planned.
Thank you. I think one of the things too that we saw the benefit of being in person is the positive impact of mental health. One question that came in the past 10 minutes is, what is campus doing to support the mental health of students and employees? At UHS, we've seen definitely increased requests for mental health services clinically. And Dr. Griggs, could you speak to a little bit about what campus is doing to support students and employees?
Yeah, absolutely. Thank you for the question. So we do have a counseling services department on campus that supports students when they have the need for individual counseling sessions, as well as group counseling. But honestly, I think that one of the greatest impacts on students' mental health is really being back on campus and having the opportunity to engage. They are at a extraordinary period in their developmental stages, and this opportunity and just being back in person is something that they need for a lot of reasons. They need it socially, they need it emotionally, and they need it mentally. And so I do think that being back on campus is something that will help students, but we do have services available to support them as anxieties increase and they begin to feel the pressures of school. With regards to employees, we have services available on campus for that as well. And so any employee that's suffering can certainly reach out to our employee assistance office if they should need counseling or, just need to touch base with someone.
Great, thank you. Actually, Dr. Griggs, while I have you, a question that just came in as well is, how will you know if someone in a classroom or a workplace tested positive? Could you speak to that, please?
Sure, that's a great question. So the standard answer is that you won't know in an official way. The university will not have a process in place where we're notifying anyone of a positive case, but what will happen is that you will hear from students or potentially coworkers who have tested positive, and they will share that information with you. They might even inform you that you're a close contact, and if that is the case, we will have information available on, again, the COVID-19 response website that'll kind of help you navigate what those next steps need to be.
Thanks, Dr. Griggs. Another question that just came in is asking about mask usage. So campus still has a mask requirement when we're inside buildings. Some people are feeling a little weary of that still. What tips can be shared about asking students and colleagues to wear their masks properly and at all times? Dr. Sethi, I'm going to ask you to respond to that one, please.
Yeah, I'll say it's not easy. I think everybody has probably come across somebody in our space on campus who isn't always wearing a mask properly, maybe not even at all at times. And I think approaching the person, showing some compassion and maybe some understanding that mask use is not always easy, but how it's really important for their own health, for everybody's health, and just engage in that conversation to encourage mask use. At some point, remind them it's a policy for us to all wear masks indoors, and there's a reason for that policy.
Thank you. Another question that emerged is, why is isolation shorter now than it was last year? Dr. Softar.
So I think, as our understanding of COVID-19 and particularly Omicron has evolved, so have these guidance policies. And every decision at this point really comes to a trade-off. We know that having people in isolation for 10 days, like we were doing before, comes with its own consequences. It's not easy to be in isolation that long. And often people will suffer psychological consequences of that prolonged length of time away from contact from anyone else. So that's one thing. And the other is, the staffing and the workforce and the economy and all the other things that need to happen. I think this is a reflection of trying to figure out a way to live with this pandemic rather than the initial approach of trying to think that we could eliminate it or eradicate it. And so what are some trade-offs that need to happen? And duration of isolation was one of them. Now, we know with Omicron that you are most contagious right before you get symptoms and for the first couple of days after. So I don't think it's an unreasonable decision to make to say that it's a 5-day cutoff. But even within that, I think people have to realize that their symptoms have to mostly be gone. They have to be feeling a lot better before you would apply that 5-day cutoff. And then, even then there's a range. There may still be some transmissibility after from day 5 to 10. And even 10 wasn't necessarily a magic number, but one has to pick something. And I think that between 5 to 10 is as reasonable at this point as anything else is, given that we have vaccination, masking, and other mitigation measures widely available.
Thank you. So students are being asked to take part in entry testing at the beginning of the semester, but we're not asking the same of employees. Dr. Griggs, could you speak to why this might be?
Yeah, absolutely. One of the things that we know about students, and we see this at the beginning of every semester, is that there is a migratory transition that happens. They travel from many different places, many different interactions, many different encounters. And so one of the goals was to really get students to take a test before they leave home, so that if they do test positive, we can catch it before they get here. And the other added benefit of that is that then they can isolate where they are. To Nasia's point, the benefit in that is that they're actually isolating around people that they're familiar with, they're with family, and so it kind of helps them from a mental health standpoint. But it does help us to reduce how much viral presence we actually have here on campus. And so the goal of that was really just to kind of catch any viral transmission that could happen, right before students leave. And given the fact that we are in a surge, or kind of like at the peak of a surge, the probability that students came in contact with the virus is probably relatively high. And so if we can have students test before they leave, just to ensure that they're not infectious, that helps us. It's one more layer of protection on campus. And then our goal is also to encourage them when they get here to pick up an antigen test and test again. Again, the goal in that is so that, when we get to classes next week, hopefully students would have tested twice.
And could you say a little bit more about why we're not asking this of employees?
Sure. The migratory behavior that we see with students, we don't really see that in the same way with employees. The vast majority of our employees have already been here. And I can say from seeing the testing data, a lot of them tested the first week after the holidays. And so the need for entry testing isn't the same because they were already here. But that is different with students. And so we did want to go that extra added step. Employees, anytime that they want to test, they can test now. Again, we won't start antigen distribution for that population until next Tuesday. And they can pick up tests at Memorial Union or Union South from 11 to 6. Either day, all they need is their WISC card. But the goal right now was really just to catch any transmission that could happen in that migration process.
Thank you. And more information about testing can be found at covidresponse.wisc.edu. Let's dive in a little bit more for testing for a question that just came in. Again, if you want to continue to submit questions, we're accepting them at go.wisc.edu/January 21. Dr. Softar, I hope you can answer this one for us. If someone has symptoms, but they test negative on an antigen test, what should they do? What if they test negative on a PCR test?
So if someone has symptoms, you can use either test to start with. If your antigen test is positive, then you have your answer and you can consider yourself to have a positive diagnosis. If the antigen test is negative, however, we know that it's not as sensitive as the PCR. So the next step then should be to get the PCR. Now, of course, not even a PCR is 100% sensitive and specific, but it is close. And so if you have symptoms and your PCR is negative, I think you can be reasonably certain that, because there's a lot of other viruses that are also circulating, that it isn't COVID, but something else that you have. But sometimes we have needed to do multiple testing for PCR in people where symptoms evolve and there isn't a clear diagnosis. But for the mass majority of folks, the PCR will give you whether it's a positive or negative, it can be relied upon.
Dr. Septer, I'm going to ask a follow-up question around that. So what would you say to somebody who might just be interested in testing weekly just for a baseline? Is that something that you recommend? When do you recommend people engage in more regular testing?
I think people will have a pretty good idea of the behaviors that they're doing and the activities that they're engaging in to figure out what their risk is of contracting a breakthrough infection in this case. And given that it's widely prevalent, I think it's not unreasonable for people to want to test themselves periodically. I was a little bit more concerned at the time when they were considered to be shortages of tests, because we then wanted to make sure that people who had symptoms and who were at really high risk had the opportunity to be tested. But now that the supply issue, at least on the face of it, seems to be a lot better, I don't think it's unreasonable for people to test whenever they feel that they might have been exposed.
Thank you. I'm going to talk a little bit more about the vaccines again, a question that came in. Dr. Sethi, I'm going to have you cover this one first. Do people need booster shots to be considered fully vaccinated?
Yeah, I mean, there's a technical definition for fully vaccinated, and then there's the practical side of things, where the evidence is pointing is that if you're boosted, you'll have the most protection against severe outcomes of COVID, and getting boosted is recommended. And I would personally consider myself fully vaccinated if I've received every recommended shot that's been made to me. And so I would say yes, in a way, even if it's not meeting a technical definition right now.
I'm going to ask you a follow-up question to that. What if someone already got COVID-19 but hadn't yet got the booster? Would you still recommend that they would get a booster?
Yeah, I mean, of course, if you ever have questions, you can talk to your doctor. But there's a lot of evidence to show that if somebody has had COVID in the past, has received the vaccines, they have better immunity than someone who has either and not the other. But getting boosted is still recommended for people, because not everybody who has COVID infection necessarily mounts a strong immune response. Some people get very mild illness and just don't produce that many antibodies as a result of it.
Great, thank you. Let's dive into a few more of these classroom questions. Dr. Zembrennan, I'm going to look to you. Are there special accommodations we're providing for folks? There are some instructors who have children who might not yet be able to be vaccinated. How are you as a professor and instructor encouraging folks just to feel a little bit safer in their classrooms?
Well, again, for those accommodations, concerns and questions, we have an established accommodations process where an instructor should be working with their divisional disability representative if they have a documented accommodation need and need to pursue that. They can work with their DDR to move through that process. In cases where it's not a matter of a condition or disability for the instructor themselves, but it's unvaccinated children or others in their lives who they're concerned about, then the best thing is to talk to their local human resources professional for support and guidance in that situation.
Great, thank you. Next are a few questions for Dr. Griggs. Do we want people to report antigen tests to campus? Sometimes we've been asking people to report positive tests, not report. What is the current guidelines around that?
Yeah, so the current guidelines for an antigen test, which is an at-home antigen test, is really not to report to submit that to University Health Services. Rather, we are directing people to submit that to PHMDC, so Public Health Madison-Dane County. We will have a link on our website if it's not already up for people to do that. That is a process that kind of helps them to track how many positive antigens we're seeing. Part of the reason that this changed is also related to just the sheer volume of antigen testing that's now available in an at-home usage. Folks can still go to the doctor and get a point of care antigen testing, which is a different type of antigen test. The test itself is similar, but since it's managed by a medical professional, that's managed in a different way. So the at-home tests are really at-home tests, and they're processed in a different way. So we don't contact trace the at-home test. We do encourage people to submit those, but there are instructions, or there will be instructions available on the COVID-19 response website, so that people can kind of understand what to do based on the results of that at-home test.
So you mentioned contact tracing. Can you talk about what UW-Madison has been doing around contact tracing and what people might be able to expect moving forward?
Absolutely. So we actually have a contact tracing team. We've had one since close to the beginning of the pandemic. And that contact tracing team, every time we have a positive PCR test, they have an electronic notification that goes out to acknowledge the positive test. And then a person actually calls the person that tested positive. And so a contact tracer will walk through a full interview with a person to get close contact, so anyone that they were in close contact with, as well as answer some other questions that we kind of need as a state, so that we can understand just the prevalence and incidence of COVID and an individual experience of COVID. And so that process is still going to be there and in place. But again, we're primarily focusing that effort on PCR testing. The at-home tests are managed in a different workflow. And so we won't contact trace those, but we will have guidance on what people need to do as they utilize those at-home kits.
Thank you. I'm going to turn back to Dr. Safdar because we've been talking a lot about antigen tests and PCR tests. How does someone know which one they should take, which test they should take?
I think they should take whatever is immediately handy. You know, the advantage of the antigen tests, especially the at-home tests, is that everything is self-contained in the box. You can have an answer in 15 minutes, and that saves a lot of time, especially if you're not feeling well and have symptoms such that you don't want to necessarily go out and about. I think if you don't have access to an antigen test but can get a PCR, that would be fine as well. So really, it's just a matter of starting with something, whatever is handy. If the antigen test is negative, you do just have to remember that if you have symptoms, you must get a PCR.
Great, thank you. And another live question that just came in. So as a reminder, we received more than 150 submitted questions before this, and then you can continue to submit questions at go.wisc.edu/January21, and we're accepting live questions, and I have a live one to read right now. And this one I'm going to send to Dr. Sethi. Is it okay to take public transportation to get to and around campus?
Yeah, I think so. I mean, public transportation has been operating through the pandemic, and I think it's reassuring that there have been policies in place that when you use public transportation that you wear a mask. That's always been the case through the pandemic. And it's a reminder that people recognize that as being a place where we're close to one another. And I think in general, precautions kind of go up a little bit. Of course, every situation is different. I think if that's what you need to use to go from one place to another, I think it's important that you get there. If you feel more comfortable not using public transportation, that's okay too. No one's forcing you.
Thank you. I will share on a personal note. I've been taking the bus for a while to and from work, and I feel completely safe. So that's just, again, a personal note, but it's great to see everyone masked and doing their best, and it's going really well for me. So let's go to another question that was submitted before. Dr. Griggs, I'm going to have you answer this one. So what should somebody do if they live off campus and get COVID, or their roommate gets COVID? How will UW support them, knowing that they have different levels of support living off campus versus living in the residence halls?
Yeah, absolutely. One of the things that we've tried to do as an institution for the last year is really educate people on best practices when they have someone in their household that's tested positive for COVID-19. And so that includes things like, the person that's positive really kind of isolating themselves off from other people, ensuring that if they come out of a room that they wear a mask. And then some of the things that Nasia mentioned earlier, really engaging in personal health. A person that's positive really needs to rest. They need to keep up on their vitamin C and really try to take care of themselves. And the person that is in the apartment or in the location with that person that tested positive, they should honestly do the same, not necessarily rest. You shouldn't take off if your roommate tested positive, but what you should do is wear a mask when you're around and ensure that you're washing your hands frequently, just to try to reduce the spread of any pathogens that might be in the residence.
Great, thank you. Another question that just came in. Dr. Sethi, do you have any indication the Omicron surge might slow down soon?
For one thing, it will slow down at some point. And I think the question is not to cling on to numbers to tell you when it's necessarily going to slow down, because a turnaround in the epidemic curve might be followed by another upswing. And several states around the country have been experiencing that, probably because when there is a turnaround, sometimes we feel like we can relax a little bit. And it's not until we really see a sustained decline in transmission where, we can, exhale and breathe, a little bit more freely. I think it's just important that when we hear nationally that things are turning around, that's not true for Wisconsin. We actually have one of the most steepest slopes right now in the country. And an epidemic curve only represents, it represents sort of an aggregation of many trends that are going on. So I think it's just important to remain safe and mitigate as much as you can at all times.
Thanks. Dr. Softer, do you have anything to add to that?
I think, from the standpoint of the healthcare system, the biggest things that we focus on is how can we make sure that patients get the care they need, whether we are in the midst of a surge or not. And so it's really for planning purposes that it's helpful for us to know where we are on the upswing or whether it's coming down or not. But just as Ajay said, I think those mitigation measures need to be in place, whether we are in the midst of a surge, going towards a peak, or heading down, because we don't know what might come next. Having said that, as part of our strategy to start to manage life living with the pandemic, I think that our mitigation measures aren't going to change necessarily from one month to the other based on how case counts are doing.
Let me ask a follow-up question to that, Dr. Softer. What happens when we have our next variant of concern? We've been through a few now. Is there anyone that you have your eye out on? Or, how can we as a campus manage that potential?
Well, I think it's inevitable that there will be additional variants. We've seen that all along through this pandemic, and that's just the way respiratory viruses behave. I think as long as we're a little bit ahead of the situation with the right vaccine, the right boosters, and so on, again, the goal is not necessarily to prevent all breakthrough infections, because we know we can't do that, but it's to manage this such that even if people do get breakthrough infections, they can recover from it and move on. So something that I think everyone is keeping an eye on to see what the next variant of concern might be. But I don't doubt that there will be something.
Thanks. Dr. Sethi, do you have any thoughts around that?
You have to take it one variant at a time. And there's no guarantee that the next variant is going to be milder. There's a lot of narratives out there, pointing in that direction, but that's not necessarily going to be the case. We'll just have to wait and see. And I think we have a variant right now that's transmitting in our communities, and our attention should be focused on that. And when another variant of concern is declared, that's when we can begin thinking about that.
Great, thank you. Dr. Softer, another one. The question is really, will we need another booster? Do you have any comments about that?
Well, I think it all has to evolve depending upon what we see in front of us. At the moment, the one booster that we have, we know that it really works pretty well against containing Omicron. So what the future will look like, I think there's a lot of potential things in the works. For instance, there's work being done on intranasal vaccines down the road. There's probably going to be some combination vaccine available. So there's no shortage of people who are working on this important problem, but whether we need one immediately, I don't think we can answer that question at this point.
Thank you. And what is campus doing in terms of collecting information about boosters? Dr. Griggs, could you please speak to if people need to report their vaccination status?
Yeah, if you have been boosted, that is very important information for us to have. And the way that you can do that is to log into My UHS. You can do that via the app, or you can do that online. And you're just going to upload that booster dose that you received. It helps us to really understand how things are going on our campus as far as how many people are vaccinated, how many people are boosted. Another thing that it does help us with is really measuring, if we get to the point where we need additional boosters, really measuring how many people might need boosters at that point. And that helps us with our planning process for our own vaccine sites and ensuring that we have stock available. And so it really is important that if you have been boosted and we don't have that information, please upload it as soon as possible.
Great, thank you. And some more information about that can be found at uhs.wisc.edu. We also have an app where you can upload that information. And again, all of this information is going to be available at covidresponse.wisc.edu. So we have another question that came in about the change in isolation around 5 days. Dr. Softer, this one I'm going to direct to you. Can everyone leave isolation after 5 days? What if someone takes a test and they're still testing positive? Does it matter if they're taking a PCR test, if they're taking an antigen test after the 5 days? What do you recommend?
So I think as we've all learned, there is a wide variation in how contagious one can be at day 5. And so if you wanted to take a test, the test to take would be an antigen test because that more accurately reflects potential transmissibility. And if the test is positive, you may want to extend your duration of isolation. The problem with PCRs, of course, is that while they're very sensitive and specific, they do tend to stay positive for a very prolonged period after, which doesn't necessarily mean contagiousness or transmissibility, but just might simply represent residual dead virus. So repeating PCRs is not recommended for that reason because the results are not helpful.
Great. I'm going to ask one follow-up again about that as well. So if you have a close contact that tests positive, but you yourself have no symptoms, should you test and wait for negative results before reporting to work or class?
So if you, let me just read the question again. So close contact that tests positive, but you have no symptoms. So no, you don't necessarily need to do that. I think the approach would be to do symptom monitoring. You should be masking and then testing yourself as indicated, but you can continue about your activities while that's happening, as long as you have no symptoms.
Great, thank you. And the emphasis again on continuing to wear a well-fitted mask after those days. So I do have a question for Dr. Griggs. Why aren't vaccinated people required to take PCR tests each week if vaccinated people can also get Omicron?
Yeah, the testing program itself and the way that we've designed that on campus is really to try to catch asymptomatic cases. And that is something that we see more in unvaccinated. It's not something that we're seeing as much in the vaccinated. And so it really is important to have a surveillance program in place to really measure that in the unvaccinated population. That said, that doesn't mean that we won't see some breakthrough infection, but that really is a different type of infection than what you see in unvaccinated folks. And so the resources that we're using to kind of put the program together, again, that's to really reduce that asymptomatic transmission element that can happen, which we do see more in the unvaccinated population.
Great, thank you. We've answered so many questions. Again, more than 150 were submitted. We've been taking live questions as well. As we start to round out our time, I do want to thank the 4 of you. This has been extremely helpful. A recording of this will remain posted at covidresponse.wisc.edu. But before I let the 4 of you go, I want to hear from each of you and ask what you're looking forward to most this semester. Dr. Griggs, I'm going to start with you.
Wow, what am I looking forward to most? Well, I think if you asked me that question a month and a half ago, I would have probably said something different. I think at this point, I'm looking forward to the Omicron surge ending, as I'm sure most folks are. I know that it creates an extraordinary amount of anxiety and pressure just because we've been in this pandemic for 2 years now. And every time we hear of another variant, it strikes fear in people. I will say that an encouraging fact is just that we really are in a different stage in the pandemic. The variants that we're dealing with and the way that we interact in the world as vaccinated people is dramatically different than what we would have done a year ago. And so that is an encouraging element. It doesn't take all of the anxiety away. But I can say for me personally, I'm looking forward to the surge ending.
Thank you. What about you, Dr. Safdar?
I'm looking forward to spring and tulips and healthcare environments that are hopefully less frenetic. I think it's so easy to get caught up in the surge and what we see on a day-to-day basis, but I do like to step back and hopefully keep a sense of perspective. You know, yes, we're still in the midst of a pandemic, but we have some amazing vaccines, we have amazing boosters, and we are hopefully in still a much better place than we were 2 years ago. So I like to hold on to that thought.
Thank you. Dr. Sethi?
I'm looking forward to teaching my class, infectious disease epidemiology. I think the conversations are going to be really stimulating for all of us, and I think that's just going to be a joy to be back in the classroom. I'm also looking forward to March Madness. The Badgers are doing well. It's an exciting season for them.
Thanks. Dr. Zambronin?
Yeah, you know, I will say as Vice Provost for Teaching and Learning, I have the real privilege and joy of hearing a lot of amazing stories about what our instructors are doing in really challenging times. And I hear those from instructors themselves, but I also benefit from conversations with students and occasionally students' parents. And so I look forward to hearing more of those wonderful success stories. You know, as an individual faculty member, I'm just looking forward to the start of another semester. It's always an incredibly exciting time. There's always something new and fresh about meeting a new group of students and jumping into content and forming relationships with them. The The course that I'm teaching this spring includes a spring break study away trip to Puerto Rico. So my challenge is to walk into a classroom next week, meet 16 students who I've never met before, and begin to fashion a relationship with them that in 7 weeks will work for us to travel together. So that's just super exciting. Can't wait.
You might also have 4 more attendees to your class for the panel. So your class of 16 might now be 20. I think we'd all be game to go to Puerto Rico for your class. So that sounds fantastic. I've really enjoyed our time together. It's gone by very quickly. Thank you for what you do and how you continue to support campus and the community. I'm very grateful. I want to let folks know that the link to this will remain active on this YouTube page, and it will be posted on the COVID-19 response website. We ask that you please continue to monitor the COVID-19 response website for the latest information and FAQs, and to also monitor your inbox for updates from the Chancellor or your HR representative. That's all we have for today. Thank you again for joining us, and be well.